Hey, what's going on, guys? Welcome back to another video of Keep It Simple Stupid. Today we're going to discuss something called delayed sequence intubation. We're going to discuss when it's used and how it's done. And hopefully you'll have a better understanding of DSI, or delayed sequence intubation, after this lecture. All right, let's get into it. All right, so first of all, let's discuss what DSI is just short for delayed sequence intubation. What is the definition, or what is the way I should conceptualize this in my head? And basically, how do you maximize pre-oxygenation in preparation for an intubation? And as we move forward in the lecture, I'll give you a scenario and this will make a little bit more sense, okay? Which brings us to our next step. So when is delayed sequence intubation useful as opposed to RSI, or rapid sequence intubation? Now again, DSI is going to be useful when you have barriers to effective pre-oxygenation. And what are examples of barriers to effective pre-oxygenation? That could be a patient who's agitated, who's delirious, who's confused, right? And I've written those out below. If you also think about it, for example, maybe you have a patient with really bad COPD and they're off oxygen and they're setting 85% and they're super confused because they're hypoxic. You're not gonna be able to bag that patient or put them on CPAP or BiPAP because they can't really follow commands. So the next question is, okay, how do I pre-oxygenate this patient enough so that I can paralyze them to successfully intubate them, right? And you don't want to attempt RSI in a patient who's satting at 85% without pre-oxygenating them because they have a very high chance of decompensating or going into cardiac arrest during the intubation attempt, right? So it's going to be useful in those patients that have barriers to effective pre-oxygenation. And then our next question is, okay, so now I have kind of an understanding of when DSI would be useful. How is it done? And the answer to that I've written out right here. It's going to be ketamine 1 to 2 milligrams per kilogram IV bolus. Now this is a dissociative dose of ketamine, and I think it's helpful to kind of contextualize the DSI as essentially you are doing a procedural sedation so that you can pre-oxygenate a patient, then paralyze them and intubate them, right? So if you think about that, so you have your agitated patient. You can't pre-oxygenate them because they're so agitated. So you give them ketamine so it chills them out, right? That's my example of a chill patient. Now you can bag them up successfully, and with that ketamine, they will be protecting their own respiratory drive, assuming you didn't oversedate them. So they're acting wild, you can't pre-oxygenate, ketamine, they're still protecting their airway, but they're no longer as agitated. Then you pre-oxygenate, then you paralyze and intubate. I hope that made sense. Well, thank you guys for listening to this video. I hope that was helpful. As always, if you have any other questions or you have any other requests for videos you'd like me to make, please let me know. I should be able to make more content this month as I have a lot more free time. And as always, like, comment, subscribe, and talk to you guys later. Thanks, and bye.